The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And good morning. It is 11:05 and time for the PinPoint Health Show with Dr. Lou. Reaching out to 1-855-55 Dr. Lou, DRLOU, info@pinpointhealth.ca. And a reminder, of course, that the social media juggernaut that is the PinPoint Health Show is increasing in coolness by the day, brother. You got some great stuff up on your Instagram and Facebook as well, advising people constantly to check back as much as they can and follow and learn. We got a guest today, right?
We do, yeah. We have a very special guest, Dr. Adam Kassem, who is a physician and also a public health expert. And so we really wanted to take this opportunity today. We've had, our public health experts in the city, in the province, and across the country have done a great job of informing us of things. Dr. Kassem has agreed to come on the show today and even take calls. So I think the big thing here is we're encouraging people, give us a call in. Ask your questions. We have this resource right now, and we thank him very much. Dr. Kassem, are you there?
Hi, Lou. How are you? Good morning.
I'm good. Yourself?
Not too bad.
Why don't you, let's get the conversation started. Why don't you tell the listeners a little bit about yourself?
Yeah, so I'm a physiatrist, which, as you are well aware, is a specialist physician who focuses on musculoskeletal and neuro rehab. And so what I mean by that is we take care of patients who've had a stroke or a spinal cord injury or a brain injury, amputations, so significant injuries that have created a significant amount of impairment in our patients. And our job is to help with the medical rehabilitation that occurs thereafter, so trying to improve patients' functional quality of life. And so it's a very challenging but often a very rewarding job that I have, and I'm fortunate enough to be able to do that.
Did we?
No, we're still. No, we're still there. We're all here. It's all good.
Oh, okay.
Yep.
It cut out on my end for some reason. All this technical difficulties. Yeah, I mean, okay. So, Dr. Kassem, just continuing there. What about with the public health? Because you have a master's in public health. Is that right?
Yeah, so I have a master's in public health from Columbia University. I spent 10 years in the United States doing my post-secondary degrees in medicine and in my undergrad as well. But I'm originally born and raised here in Toronto and have been working, throughout this pandemic with hospitals. And so this is, an interesting time to be in practice, and I have to say, Lou, if you'll allow me, I'd like to shout out all of the frontline health workers, doctors on the front lines, nurses, emergency services. These are people who are putting life and limb ahead of themselves, and their personal sacrifice has been an inspiration to me, and I'm sure many of your listeners across the province. So I just wanted to thank them for their dutiful service during this very, very challenging time.
Yeah, 100%. And I echo that. In fact, at PinPoint Health, we have a number of our practitioners, whether they're physicians or physiotherapists or other healthcare professionals that are actually on the hospitals that are working on the front line, like you said, and they are putting their life on the line here, really doing the best that they can. And, more so, and when I've spoken to these people, again, reiterating the other people, the emergency care services like paramedics, fire that have to present to people's homes, even everyone else at the grocery store. So this is, it's unbelievable what the human spirit has done here in terms of everybody coming together and doing their part. And then I guess to some extent, even the people that are staying home, right? They're doing their part by staying home and sort of taking the load off in terms of where we're at. What's your take on where we're at with COVID-19 from a public health perspective?
Yeah, Lou, look, I think that we're still in early innings of this ball game, right? We might be on the top of the second, top of the third. And the reason I say that is because we're, at least in Canada, very much at the early phase of this. In many respects, until we have a vaccine, which we know from our sort of scientific expertise, and the scientists are telling us that this is going to take at least 12 to 18 months from discovery to demonstrating safety and efficacy in a population, and then ultimately the design and then the deployment of a vaccine. That is going to be an extended period of time. And so until then, as you were alluding to, it's going to be the onus is going to be on each and every one of us in the public to make sure that we continue these distancing measures. And so far, from global health experts around the world, this is shown to be the most effective strategy for dealing with COVID-19 right now, right? We don't have great therapeutics, so we don't have great medications that work against this virus yet. We don't have a vaccine, of course. And so until that time comes, we're going to be in this mitigation phase. And that's going to last an indefinite amount of time, and it's going to require each of us to do our part by maintaining those distancing strategies that we're all trying to do as best as we can.
Yeah, and I think that's a really important point that you bring up, because I think for the average person, there may be this idea that this is, a week away from being done, or 2 weeks, or a month, and I don't think that it's abundantly clear maybe that this is something that we are sort of in the beginning stages of, and that we've got a lot to go. But we're going to go to commercial break, and then when we come back, let's encourage everybody to call in and ask your questions with Dr. Kassem here today.
This would be the best time for you to call. I know you got questions about this whole pandemic. Everyone's scratching their heads big time. 416-870-6400. Pinpoint Health Show. Just getting warmed up here. Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
It is 11:15. Yeah, you want to call in. You still got tons of time here. In fact, we're just getting rolling here with Dr. Adam Kassem. If you want to ask about this COVID virus, yeah, man, bring it on, because there's so much confusion about how to keep a safe distance and what you should be wearing, what you should not be wearing. By the way, a brand new podcast Dr. Lou's got going on called The Lou Down, L-O-U, The Lou Down. I love the name of it. And so far, every one of the podcasts, brother, has been about COVID-19. Go figure. I mean, it's very topical. Where can we find it?
Yeah, so it's on YouTube. Dr. Kassem, who's here today with us, is also one of our guests on that. So really the whole point behind this podcast was to be a spin-off of the show for all things COVID right now. So you can you go to YouTube, type in the Lou Down podcast or Dr. Lou Nally, and watch these incredible episodes with all these incredible guests that have so much more knowledge than I one of my strengths is knowing my weaknesses, and that's why I rely on experts like Dr. Kassem, who's here with us today, who is a public health expert sharing his knowledge about these things with COVID. And I see we've got calls starting to come in. But before we're ready for those calls, because I don't think they're quite ready yet, Dr. Kassem, before we went to break, we were quickly talking about how early we are in this and how much we have to still do. Where are we at with therapeutics? Before we get into prevention like vaccinations, can you give us, before these calls are ready, can you give us a little snippet of where we might be with some therapeutics?
Yeah, so that's a good question, Lou, and I think that we're, as a global medical community, undergoing many, many clinical trials at this point in time. And I know that, of course, one of the sort of more popularized medications of late, given sort of the rhetoric in the United States, has been hydroxychloroquine and azithromycin. And right now, there really isn't any good evidence to suggest that that hydroxychloroquine would work in any meaningful way for COVID. So right. I think that is something that's important to recognize, because even in Ontario, there has been an uptick in the requests for hydroxychloroquine by patients of physicians. And that's based purely, my understanding is based purely on this ongoing hypothesis about hydroxychloroquine. So, for your
right.
listeners, what's important to very, very clearly understand is that hydroxychloroquine right now has no evidence for treatment of COVID-19. And so we shouldn't be looking at that as a therapeutic. There are other, autoimmune modulator medications that are currently being studied, but right now we are still kind of at the tip of the spear here, and we don't really have very, very good evidence for anything right now, unfortunately.
Yeah, and I think it's important. Like, we've heard the example of I think it was in Arizona, where someone actually took a fishbowl cleaner, which has some type of derivative that's related to chloroquine, and like, those, don't do those things. Like, it's crazy that we even have to tell people not to do this stuff. I had last week we had Dr. Liepert on the show, who's a frontline physician, an intensivist in Calgary, and he's been on the podcast as well, and we were talking about where he's also seen things like people saying drink bleach, like. Oh. Do not do that stuff. Like, I cannot make it clear enough, and I can't even believe that we have to talk about this stuff. But thank you for that clarification on where we are with the therapeutics. John, maybe let's go to some of these calls.
You bet. We'll go here, 416-870-6400. We'll take one before we take a quick break here. Chris, good morning. How are you?
Hey, John. How are you?
Good, Pally. What's on your mind?
I just wanted to say, first of all, thank you to yourself and to the doctors. I live in rural Ontario. I deal with a lot of senior citizens, and their anxieties are quite high. They've actually, they've relocated from Toronto years ago and come up here. And so what I've been telling them to do is on the weekends, throw your radio show on, right? Yeah. And I was actually just sitting down by the park this morning having a cup of coffee, and there was one of the seniors, and we had our vehicles parked across from one another talking, and that's what he said. He had the show on, and I had the show on. So,
thank you.
I just want to say, the aspect of keep up, the work that you guys are doing, both. The radio station, yourself, and all the people behind the scenes, as well as the doctors. And as the individual just said earlier, do not drink bleach. Believe me.
Thank you, Chris.
I worked up in mental health and addictions up in the Northwest Territories and for a number of years, and the stuff that goes on up there. So hopefully, stuff like this, these radio shows can get the people up, in remote communities and stuff like that. So they'll be able to hear all this stuff. So, anyways, guys, have a great day. Be safe, and thanks again.
Thanks, Chris. Appreciate you, too. Glenn, we'll get to you. Jerome, I see you standing there. Questions for Dr. Adam Kassem. Bring them on, or Dr. Lou for that matter. Physical stuff, COVID stuff, we'll tackle it all with the remaining time here on the Pinpoint Health Show. Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
It is 11:23, Pinpoint Health Show. Reach out, info@pinpointhealth.ca and 1-855-55 Lou as well. And don't miss the Lou Down, the new podcast series.
Yeah, and John, before we go to these next calls with the previous caller, Chris, who called from up in Orillia, number one, thank you. It's a great compliment that he finds benefit in the show. And I was going to say there's more benefit in not more than the show, but keep carrying that benefit on by going to YouTube, checking out the Lou Down podcast. And the other thing where he spoke about mental health, tremendously important. And in fact, next week, just for the listeners, we're actually going to have Minister Michael Tabulo on the show, who is the Minister of Mental Health and Addictions, to really talk about the importance of mental health during this pandemic. So that's another important thing, and we'll be going through a whole bunch of different tips, resources, things that are available for people who are struggling with those things during this time. But let's get to some of these calls, John.
You bet. Glenn, thanks for hanging on. How are you?
I'm good, thank you. How are you guys doing today?
Good. What's on your mind, brother?
For years, a few years now, about 4, I've had degenerative disc problems in my neck, and I've had sciatica in my lower back. I was just wondering, a lot of people have been telling me to try the CBD oil. It seems like nothing else works for me, so I just wanted to know about that a little bit.
Okay. I mean, we're sort of focusing on COVID, but having said that, we do have Dr. Kassem, who's a physiatrist, and like he said, sort of physical medicine and rehabilitation is his specialty. It's something that I do as well. But Dr. Kassem, if you want to provide any insight on that, I mean, it's a loaded question because in terms of we need to know things, but in general, maybe if you want to give us just what the research suggests with, chronic neck and low back pain and CBD oils.
Yeah, so that's a good question, and of course, it is highly dependent on the individual. And I would, recommend that you be assessed by your family physician or be referred to a specialist. But generally speaking, when we think about degenerative disc disease, as you're describing, and perhaps some radicular pain down your leg from the sciatica that you have as well, which I'm sorry that you're dealing with, which can be in many cases
some days it's very painful.
And we see a lot of patients like this, and so I'm sorry that you're having to deal with this. And a lot of those degenerative diseases, which are kind of wear and tear and related to osteoarthritis and kind of mechanical lower back pain, or in your case, neck pain. We don't have great evidence for CBD yet, although it is showing some promise. So that's a bit of a guarded question. One of the or sort of a recommendation. What I would say is what's been shown to be very, very useful as far as guidelines are concerned for osteoarthritic pain, whether it's knee, hip, back pain. Tylenol and Advil are very good, but also making sure that we are doing things like core stabilization, making sure that we are hopefully trying to lose as much weight as possible so that we're taking off that pressure from our joints. And, there is some relief, and it might be temporary, but for things like massage and muscle release therapies. And so what I would say for the most part is focusing on all of the conservative management, and then from a medication perspective, that's something you want to talk about with your doctor. And CBD is certainly on the list, but it's probably not on the top of that list.
Okay. All right. Thanks for the info.
No, thanks, Glenn. Appreciate you reaching out. Moving on to Marcel. Hello, Marcel. Good morning.
Hey, how you guys doing there? Thank you for giving us all this information. But I got a question.
Sure.
Like we're sitting at home, we need something to drink. We're drinking lots of alcohol, I know that, but
probably not a great idea.
Is there like a little potion we can make to help this COVID? Like I heard making a pot of water with lemon.
Lemon? No.
Okay, well, I mean, number one, like in terms of alcohol is not going to help with COVID. I think what I'd like to spin out of your question is the idea, are there home remedies that potentially work? And I think that's an important thing to dispel as well, because Dr. Kassam, again, because you're our guest today, I really want to turn it to you. What sort of, again, the guidance on home remedies for this type of stuff?
Yeah, so there really isn't any home remedy. And one of the things that we should be very mindful of is there were reports out of Iran, actually, after COVID, I guess, broke out there. I think there were almost 40 or 50 people that died because of alcohol poisoning for this very issue. They were told or somehow understood, misunderstood that alcohol was a treatment for COVID, and people died. And so alcohol is absolutely not a treatment or an effective treatment for any viral disease, to be very honest. And so I would exercise extreme caution. I will agree that when the LCBO shares its revenues, I'm sure it's going to see a significant rise in the amount of sort of product that they're moving through the LCBO doors. And that kind of reflects our general kind of stay-at-home guidelines. And so I think that what we should try and do from a public health as well as just a personal health perspective is to make sure that we're still adhering to, there are guidelines for the amount of alcohol anyone should drink sort of over the week. And just to be clear for your viewers, or for your listeners, it's at no more than 14 alcoholic beverages per week for men and no more than 10 for women per week. And it's no more than 3 in a sitting per sitting for guys, and no more than 2 at a time for women. So, those guidelines are from Public Health Canada, from these other guidelines. So we just should make sure that we're adhering to those as best as we can.
Absolutely. And I think I'd even go one step further, because I'm a little maybe more harsh than you are. And then you're very nice. The reality is here, when we look at the risk of serious illness with COVID-19, we know that a lot of comorbidities, which we've heard that term a lot, really contributes to this. And a lot of these are lifestyle things like hypertension, diabetes. So don't do stuff to negatively affect your health right now is, I guess, the message. Let's take a a quick break, John.
You bet. We'll do that. Jamie, hang on. We'll get to your call and yours as well. 416-870-6400. Dr. Adam Kassem is here for the remainder of the show. Bring him on. We'd love to talk to you right here. Pinpoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Questions for the remainder, 416-870-6400. After that, you want to reach out to Dr. Lou. Simple, info@pinpointhealth.ca and 1-855-55-Dr. Lou. That's DRLOU. And the Lou Down on YouTube now, a new podcast series as of late because it just got revved up here. Has been dealing and focusing on COVID-19. And you have phone calls in that regard. They will have priority, but bring them all on if you have physical ailments. Dr. Adam Kassem is here to address those as well. Jamie, thank you for hanging on. Good afternoon, or at least good morning so far. How are you?
Yeah, not so good. Good morning. Thank you for taking my call. Now, back in February, I was diagnosed with chronic pain syndrome, and I've had a lot of it in both of my legs, and now, the doctor gave me a medication you guys should be aware of or familiar with. It's called gabapentin. And the medicine really seems to work. But then, really, if I don't take my dosage, I find that the pain comes back. And now, chronic pain syndrome, it's been taking over my life, and I really don't want to go on pain medication forever. What other alternatives can you do for chronic pain syndrome?
So, David, thanks for calling in.
Harry.
So this is something that we deal outside of COVID-19. This is what the Pinpoint Health Show is designed for. It's mainly around pain management and injury management. So it's a great question. If you've listened to the show before, you know that the answer is very, very complicated. It's not one simple thing that can be done. And as Dr. Kassem alluded with our previous callers, the best thing always is to be assessed properly by a healthcare professional to get this investigated. We're not going to be able to give any type of specific advice on other things that you could try over the radio, obviously. Again, sort of extracting what I think is important from the call and turning it to Dr. Kassem is the idea of gabapentin. And sort of, Dr. Kassem, if you just want to take us through quickly gabapentin, because we've got a lot of calls coming in for the COVID stuff, which I think is important. But let's give David some advice, just sort of, or not really advice, but just sort of a general overview of what gabapentin is.
Sure. So sorry that you're dealing with everything that's happening in your life, and dealing with chronic pain is such a challenge, and it can be very debilitating. So I'm empathetic of what you're going through. For chronic pain, and it really depends on the type of pain we're talking about. But generally speaking, for chronic pain, gabapentin tends to be one of the first line medications that's often used. And again, depending on the type of pain, if it's neuropathic or if it's more mechanical, etc., soft tissue, myofascial, what have you. But generally speaking, gabapentin is a fairly well-regarded, well-tolerated medication. Part of the reason why that's the case is that you can escalate the dose, periodically, but also there's a lot of room to do that. It's typically dosed 3 times a day. And so generally speaking, it's well tolerated. It's been around for a while, and there's a lot of room for movement there. There's also a cousin of gabapentin called Lyrica that is often also used. But what I would say is if it is helping right now and if it's being monitored by your doctor, and if you're finding some relief from it and getting some more functional quality of life, I think it might be a reasonable thing to continue trying to assess with your doctor.
Okay, great.
Appreciate the call. Appreciate the call. Jamie, going to move on here to Rob. Hey, Rob, good morning.
Hey, how are you? I just wanted to get your opinion on, we all know that Trump is starting to open up some of the states. When do you think that Doug Ford, I know it's a loaded question, when do you think that this will, the cases will hit a peak and that we can start opening up Ontario?
Yeah, so I mean, that's a loaded question. I think in a second I'm going to turn it over to Dr. Kassem about the peak, because that's sort of his expertise with public health, and he can sort of maybe speak about that. In terms of when things will reopen, that's obviously very, very hard to say. One thing that I would encourage is with the Lou Down podcast is actually on Monday. We're going to have Michael Ford, who's a counselor in Toronto, speaking about some of these things. So we're going to try to tackle all these types of issues. So give a listen there. That there might be some indications there. But Dr. Kassem, I think, again, sort of extracting where your expertise is out of the questions, the peak of where we're at. And that's going to vary, obviously, depending region to region, because not everybody started at the same time. But I guess with us being in Toronto, what's your take on that?
Yeah, so this is a good question, and it's highly variable based, as you said, on your geography, where you reside, and where sort of the virus is hitting the communities at different times. I would say in Toronto right now, if we listen to Dr. Eileen Davila and other public health experts, the anticipation of a peak is probably now and over the course of the next 5 to 7 days, right? And so I think that that is our window to really be mindful. But we should also understand, as you rightfully said, that the peak can move, right? This is a moving target based on what measures are in place and how much the virus is reacting to these distancing measures. And what I'll say is that, if you look at other jurisdictions around the world, and China is a good example, and I agree that some of their data is subject to, I think, further scrutiny. But when they decided to start opening up areas of the economy and other jurisdictions, when they had single-digit deaths for at least 2 weeks. And so that's kind of the metric. So if you have 2 weeks of sustained single-digit deaths that are hopefully in decline, that's then a measure, or at least a metric, that they have used in order to determine when they're going to be reopening. We're not at that point yet, and which is why all of our public health experts are saying, weeks, if not months, of distancing measures will be continuing to be in place in order to help with this mitigation effort.
Yeah, and I think that's a great point. I think one thing that people think, because they've heard this peak idea, it's almost a false sense of security that the belief that you get to the peak means that you're through it. It's just a milestone, right? This is all about different phases, and the peak is the next phase of this, where we could say, okay, we're starting to hit where the peak is, then we're going to come around the corner. But the time that it took us to get there is likely the time it'll take us to get down. So that sort of can give some indications. The other thing that I'll say to the listeners is, this, we're learning, right? So it's all about, and China, from the perspective of it being an example, is a good example. I agree that there's a lot of scrutiny, a lot of things that have happened that I have some political beliefs about, that things have been done wrong, and we're not going to get into that. But we can definitely look at their model in terms of how long they were closed down for, when they start to open back up, and sort of start to extrapolate that data and see where we might be. So I hope that gives you a little bit of indication there, Rob, on when it might open back up. But, listen to the Lou Down podcast when we have the politicians on there to get more on that.
David, we'll get to your call as well. We still have time for yours. It is 416-870-6400. Dr. Adam Kassem will remain here for the entirety of the show. Bring it on. You want to talk about COVID-19. You have concerns about that. That's what we're talking about as well. It is the PinPoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
11:43 on Saturday morning, PinPoint Health Show, 416-870-6400 to call through. Ask Dr. Lou, Dr. Kassem a question, especially if it's COVID-19 related, because there's a lot of confusion out there. You want to tune in as well to the Lou Down, the new podcast with Dr. Lou. You can search that out on YouTube, and to reach out when the show's not on, 1-855-55 Lou, and info@pinpointhealth.ca. Going to move right on, fellas, to David. David, thanks for hanging on through the break. Good morning.
Good morning. How's it going?
Good, pal. What's on your mind?
So I'm a public health inspector. They got me giving test results, negative results to people, and positive results to people. I'm just wondering why a mass testing hasn't been done, nationwide. Like, if like my friends are asking me like how can they get tested, and some of the screening processes like won't allow them to get tested if they have symptoms and they traveled. I'm just wondering why it's so stringent on testing.
Dr. Kassem, I'm going to turn it right to you, and then maybe I'll add some stuff at the end.
Sure. So this is a really good question, and is a source of frustration within even the screening medical community. I think that the simple answer is that we have shortages of a number of different choke points for testing. So testing kits, swabs, reagents, the capacity in our labs. We have shortages of all of these things. And, it's one thing for officials to say that, we have targets of 3,000 tests a day or 19,000 tests a day or whatever it is. But the fact of the matter is that that shortage of the supply of these essential, products limits our ability to do that. And that is a question that's going to have to be answered to our public health officials and our governments as we move on in this. Because at the end of the day, as you're right, as you're rightfully describing, we need to have widespread testing in order to really figure out where we're at with this virus, what the real numbers are, what kind of community spread do we see, and this will have implications on how we deal with the second or third waves before the vaccine comes down the line. So I completely agree with you. I think that it's a source of frustration, and we need to have better answers and better results.
And go ahead.
Thank you. Another part to my question is, since we know the testing results of the positives, why can't we have more stringent enforcement done on them, like on the positive cases, so we make sure that they stay home and isolate themselves? Like ankle bracelets could be implemented so we know that they're always staying home. Is a possible idea.
That's another good question. I think that that's something that you have to pose to legislators, to your elected officials, because that is something that is dependent on how we not only respect people's freedoms in this country, but also how do we make sure that we are protecting the public health of individuals across our country. So I think that that's a very challenging question, and there are other jurisdictions around the world. I think the UK is one of them that's using GPS as a way to monitor sort of contact tracing as well as positive cases. And so there is, I think, ongoing debate at a legislative level, at a political level, which is where this decision would be made about the kinds of restrictions that should be imposed on positive cases.
Yeah, and I'd like to add something to that as well. I think the important thing to consider is I think 99.9% of people that do test positive would do the right thing. They wouldn't need to be enforced to stay home and do things. Again, I think there's this false sense of security that things that are law sort of provide a benefit. And the example that I gave a few weeks ago was related to sort of gun control, right? And this is not a conversation around gun control or whether I agree or disagree or anything like that. It's just the example that oftentimes rules are made for that 0.01% of the population that likely won't listen to them anyways. And so that's, I think, another thing that legislatively needs to be considered when they're doing these things. These people that would otherwise disobey these orders likely have something in them that will probably make them disobey it, whether it's law or not law. And so I think that's an important thing to consider. And I mean, I think that's a hot topic. I don't necessarily, again, I'm not trying to say that I don't think that it should be a rule. I do think there is a benefit to having some rule where we can trace those things. But I think, I guess the point that I'm trying to get across is really, that individuals need to take that sense of responsibility too. Like if you have tested positive, you've been told that you're positive, or they've told you to self-isolate because even if you haven't been tested, there's enough symptoms to suggest that maybe there is, do the right thing. Take that responsibility on to yourself to do the right thing for you and for everybody else. And that's sort of the point that I want to make there with that. And again, whether people disagree or agree with that is just sort of my 2 cents on it.
I agree with that.
Thank you. Thanks, Dr. Kassem. I appreciate that. Yeah, so I think that was a very good question. I think even the first part of the question with the limited amount of testing. I mean, when we look at, I saw an interesting article about countries around the world that have done the best job with this, and Taiwan is really a place where they've done a great job. Early on, they stopped travel from the mainland China, so they were able to limit that way. They did a lot of testing and a lot of contact tracing, and I think contact tracing is another thing really that sort of needs to be implemented. Your thoughts on that?
Yeah, absolutely. I mean, I think this is part of the mitigation effort, right? So it's one thing to isolate when you know you have, when you tested positive or have symptoms that are consistent with COVID. It's another thing entirely if you were pre-symptomatic and were, shedding the virus and so therefore contagious at that time. It's important to know who else you were in contact with because this is the basis of exponential growth. And so not only is it broad testing, but also contact tracing to make sure that everyone that had been coming into contact with a potentially positive case is also either tested, screened, and potentially isolated in their own right. So that's an extremely important back-end effort that public health agencies have to do in order to help mitigate the spread of this disease.
Fellas, let's take one more short break here. In the meantime, some time to line up some calls. You have questions for either Dr. Kasim or Dr. Lou. That's why they're here. Bring them on, 416-870-6400, Pinpoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And a few minutes left to go. You want to ask some questions for Dr. Lou or Dr. Kasim, you could do so. In the meantime, reaching out, 1-855 Dr. Lou, info@pinpointhealth.ca, and the Lou Down, the new podcast with Dr. Lou is online at YouTube. So check that out as well, guys.
Thank you, John. Dr. Kasim, before we went to break, we were talking about the contact tracing, and you very well mentioned how important it is. Where are we at with that in, Toronto, Ontario, and maybe Canada on a broader context?
So I don't necessarily have a good answer for you there because I'm not involved sort of at the public health agencies who are actually doing this. What I can tell you is that it's probably it's a huge undertaking, right? So you can imagine, let's say you had someone who was COVID positive who found out, let's say 2 days ago, and now the public health agency needs to figure out, okay, over the course of the past X number of days, where exactly did this person go? Who would have been potentially in contact with this individual? And it's also an imperfect science, right? Because it is reliant on that individual remembering where they were, but it then also requires them to be mindful of who else was around potentially, right? And so sometimes you can do that with if they've made a transaction, let's say at a grocery store, and so you could then go back into those records and see who else was in the store at the same time and who else bought things in and around that time. And so you would have to then talk to those individuals. But what I can tell you is that it is a massive undertaking. So it's not only screening of people who potentially have the disease, but again, everyone else who they may have come in contact with, which I think speaks to the fact that this is such an infrastructure that probably has been underfunded for such a long time that it is probably always playing a little bit of catch up right now.
Right. Yeah. So and I think you're right about there with human reporting and trying to figure out. It is an imperfect science, and I think that's an important thing. I do think it is important, though. So hopefully we get there. Since we're in the last segment of the show, sort of want to leave it open for you. Are there any things that you think the listeners should know, anything that we haven't talked about right now, something that's sort of near and dear to you that you think is really important? We'd love to hear it.
Sure. So I appreciate that opportunity, Lou. And, I just want to say, first of all, thank you for having me on. And I appreciate the work that you're doing to educate your listeners. I think it's an extremely valuable service. And so, please continue doing all that strong work. What I will say is that, I wanted to shout out a lot of my fellow physicians on the front lines. Right now, they have had such an upheaval in terms of their ability to practice medicine. They have had to accelerate their abilities to go to virtual care. And what I can tell you right now, Lou, is that these doctors are not being paid for their work. And this is a huge issue. And we need the government to do the right thing here and make sure that the frontline workers, the ones that are putting their limb and life on the line here, to be paid. And we can't wait in 1 or 2 months or 3 months for this to happen, because by that time, we might not have another healthcare system for a post-COVID, a post-pandemic era. So we need the government to do the right thing here. So thank you for letting me share that with your listeners.
Yeah, no problem. And I saw that there was an article that I believe the OMA was calling on the government to even do some type of an advance pay and not wait that long. And I absolutely agree with you. And I also, with you focusing on physicians and myself as an allied healthcare professional, as a chiropractor, I echo that for all of the allied healthcare professionals. Our regulatory bodies, the government needs to consider the limited ability that we have. Healthcare is not one person, as you are well aware. It's a group of people that come together that provide this incredibly important service. And I think I really think that point that you bring up is so important in so many different ways for physicians to get paid for all the great work that they do, but also for the government to consider the long-term health consequences in our ability to be so severely limited to practice right now. There are other things that are going to go wrong in healthcare, and you and I spoke about some of those things on the podcast. So I'll just let people go to that if they want to hear more about that. But I think we're both on the same page that healthcare is very, very essential, and this is sort of unprecedented in terms of how much all of us have been limited in our ability to practice and do things and really help people. And people are afraid to even go to hospitals, to clinics and all of those things, right? Justifiably so. So there needs to be something in place that makes sure that people can still get the health care that they deserve in Ontario. And sorry, go ahead before I say something. No, you're hitting the nail on the head here, Lou. And I just want to reiterate the fact that you and our Allied Health are the backbones of this healthcare system, and we need this healthcare system to be robust. We need it to be there for people, and we need it to be there after this pandemic and also during it. For sure. Dr. Adam Kassem, I very, very much appreciate you being here, providing all the expertise. I thank you so much. I thank you for all the work that you're doing. My platforms, whether it's this show, the podcast is always open for you. If you have an important message, feel free to reach out to me, and we'll get you back on for sure. Thank you, Lou.
Thanks, guys. That's it for another show. We gotta get out of here. You want to reach out now? 1-855-55 Dr. Lou, DRLOU. info@pinpointhealth.ca, and anytime go to the Lou Down, the new podcast on YouTube. We'll catch you next time on the Pinpoint Health Show, Global News Radio.
The preceding was a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.